Hello, everyone. Welcome to Revive Health's Daily Briefing Live for Monday, April 20th. This is our 30-minute review of the latest and most important news, resources, and advice for health system marketers and communicators dealing with the COVID-19 crisis. I am Chris Bevelow, Health System Practice Lead at Revive Health, and your host for the show. I am joined by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Hey, Chris.
Good to see you again, sir.
You as well.
And today we are joined once again by Ben Fuqua, who leads our data analytics group here at Revive Health. Ben has been on a couple times before, and he is back to talk about the latest iteration of our consumer survey. Hello, Ben.
Hey, Chris. Thanks for having me back on the program today.
Yes, thanks for joining. We got a lot to dive into, so looking forward to that. As with each show, we plan on covering the latest news on COVID-19 and how it relates to marketing communications. We'll provide some resources and, most importantly, share what we're hearing and seeing from our comm professionals. And in this case, we're going to spend a lot of time what we're seeing and hearing from consumers. We also want this to be an interactive forum. So if you have any questions for Ben or myself or Chase, please use the question queue at the bottom of your Zoom window. You can put your question in there at any time, and we'll get to as many as we can at the end of the show. You can also use the chat function if you want to talk to other attendees. Chase will also be using the chat function to put links in as we go, as we talk about things. So if you want to go look at something while we're talking about it, you can do that. But if you have a question, make sure it ends up in that Q&A queue so we see it. Remember, you can subscribe to this podcast on iTunes so you can listen to it whenever it is convenient for you. Search for Revive Health Daily Briefing Live. We also post a recording of this episode every day. So by the end of today, that will be available, a video version on our website at thinkrevivehealth.com. We have a banner at the top of our homepage. You can click through that to our communications hub. If you want to go right to that, you go to thinkrevivehealth.com/COVID-19. Couple of important notes we always lead with. We are not medical or scientific experts on COVID-19, so not a place to come for that kind of advice. We do have opinions on marketing and communications related to the crisis for hospitals and health systems, but just keep in mind, everybody's situation obviously is unique, your market, your organization. So just take everything we say within the context of what you're dealing with specifically. So let's begin. We always start with news, and we always start news with the latest case count. And we do that so that we have just an umbrella kind of perspective on everything we're going to be talking about as we kind of move through this crisis. How we think about things will obviously change. And so we want to have that kind of top level view on where we're at. So we use the Johns Hopkins University tool. And when I refresh that, in terms of total cases globally, we're at 2,435,876 with 167,369 deaths. That's globally. And then we look at the United States. We click through that. We're up to 761,991 confirmed cases. Though I'm gonna say this without having a citation. So boy, I hope this is right. I won't call out the person who said it earlier, but they cited a recent study. I think it was by Stanford. So Chase, maybe you can look for this while I'm talking about it live on air. And they did a study that said the number of actual cases of COVID-19 in their study, it could be as high as 81 times the number of confirmed cases, given how slow we were and still are struggling with testing. Which is an extraordinary number if I'm quoting it accurately. So obviously the confirmed cases here are what we can actually confirm with testing, but that actually might be far higher. We know that the deaths count right now in the United States is 40,724. That is also confirmed deaths, though New York has also included a number of deaths to up their count that weren't necessarily confirmed COVID cases, but they believe were. And so just as we heard with the case confirmation being potentially higher if we tested everybody, the death count might actually also be higher. We just don't know if we were able to confirm all of those cases. So that's where we're at. Another thing we wanted to point out is obviously given the release on Thursday of the White House's guidelines for reopening the country, quickly included in that was very high level guidance on hospitals reopening. And quickly following that, we got two significant resources. The first was AHA, ACS, and a number of other associations released their guidelines for hospitals and health systems reopening on Friday. And then CMS followed suit on Sunday. And we are right now working to review those, to understand them, to see if there's any key differences. Even in just a glossary, kind of glossing through, I should say, you can find some differences. One we found just talking about it at the opening of the show was in the CMS guidelines talking about PPE. They have a statement that says every effort should be made to conserve personal protective equipment. So that's their guidance on that. The guidance given by ACS, AHA, and a number of other organizations says, in terms of personal protective equipment, facilities should not resume elective surgical procedures until they have adequate PPE and medical surgical supplies appropriate to the number of type of procedures to be performed. So right there, you can see a difference, right, in what those guidelines are. One is, hey, PPE is important. The other one says you shouldn't be doing anything else until you have enough PPE. So we're going to be looking for more kind of distinctions between those. And we can get into why they might be different. But again, really important for health systems to understand what those are and how they might apply to their situation. So Chase will be providing links to those in the chat channel if he hasn't already. Resources, a couple of resources we want to point out before we dive in with Ben. The first is our communications hub. I mentioned that earlier. That's where we post episodes of this show. We also have at that link, which is thinkrevivehealth.com/COVID-19. Excuse me. We have content from our bi-weekly roundups that we send out twice a week on COVID-19 for hospitals and health systems, as well as all the results of our survey. And we have the latest results that were issued Saturday, which is why Ben is here to share the highlights of those with us today. So you're going to get a nice preview of what's there on this show if you're with us. And the other thing is make sure you join us tomorrow. Really important. We're having a very special 1-hour episode of Daily Briefing Live. We will be joined once again by Brandon Edwards, who's CEO at ReviveHealth. He was with us just over 2 weeks ago, introducing the concept of rapid recovery. Now, obviously, we're talking about reopening in different stages across the country. We have states like Ohio and Oklahoma that are moving quicker in terms of hospitals and health systems reopening. For us and for your organizations, this rapid recovery period, that's what we're calling it, because you need to recover rapidly in terms of your financial situation, is absolutely critical to the health and well-being of your organization moving forward. And so we're going to spend an hour talking about rapid recovery. Again, what do we mean by it? Why is it so critical? What are some ways to think about it? And then our specific approach to planning for rapid recovery. We'll share some highlights for that. So make sure you join us tomorrow. Chase is posting a link in the chat channel so you can sign up for that. You can get a calendar invite, but hopefully we have a lot of people join us, because now is the time to be thinking about planning for this really, really important phase, which some of us aren't quite ready for, but all of us are close enough to be planning for it. So join us tomorrow, noon Central, for an hour. All right, Ben, enough of me yapping. Let's hear from you. So we really wanted to spend some time digging into the third iteration of our consumer survey. So I'll give you a chance to kind of give, to start the high level on what the survey is, how many people, that type of thing. And then we asked some different questions on this third iteration, specifically about consumers and their comfort with returning, comfort level with returning to hospitals and health systems post-COVID. So let's dig in there.
Okay, thanks. I would say this survey has been a journey for us. We started off with the idea of wanting to understand how people were getting information, who they trusted information from. And as we move towards this recovery period, we've really started to focus in on understanding where consumers' hesitations might exist. and what hospital systems could do to address some of those concerns. We've stayed with some of the original questions about, how often do I want to hear from a hospital system? What is it that I would like to hear? Which channels are most valuable? And in this time period, I really think we start to hone in on how we introduce recovery back into the population that would be most in need of it at this point. So this is our third iteration. Again, we surveyed 700 people across the country. Our margins of error are similar to previous surveys. And I wanted to start off by talking about the first question that we asked, or one of the questions that we asked this time, which was, when would you be most comfortable in going back to a hospital? When is that going to be for you? And across our 700 people, 35% of them said that they would seek care within the next month. So that's the immediately and within 1 month bands there. You see 64% within 3 months, and then 36% that are beyond that 3 month period. So if you think about this, we start to see that, everybody's not immediately comfortable going back to a hospital. When we dig into what it is that starts to create that reluctance or that hesitation, we see that it's primarily people that are most concerned about having chronic or serious conditions that are interested in going back earlier rather than later. So I think as we start to think about what these guidelines say for us, Chris, is we start to think about some of the suggestions about opening, when protective equipment's available, when facilities are available. We really have to do a good job of convincing people that are in those, delayed or chronic situations that it's okay to come back. And they're the audience that we should focus on first and foremost.
Yeah, Ben, let me weigh in there. We are hearing from health systems, a few of them across the country, particularly in harder hit areas, where people, we've seen news stories on this, where emergency room physicians, for example, are saying, where did all the heart attacks and strokes go? Because we are not seeing near the level of those that we should be. And we are hearing that folks are just, even when they're experiencing significant episodes that could be a heart attack or a stroke or anything like that, refusing to go to the hospital because they're too scared of catching COVID. And so we just have to understand how long that is going to last. That's not good now. These people need care now. And obviously hospitals can certainly treat people who are in life-threatening situations. But as we move forward, this is going to be super important. The other thing I'm going to just mention is for the people that are listening to this on a podcast, after they've downloaded it, make sure you go to that COVID hub that I talked about before, where you can see these charts that Ben is describing. And Ben, I just encourage you to keep talking to the numbers as you're doing, so that people are listening can get the data, even if they're not seeing what's on here.
Sure thing. So if we keep going down, Chase, even after restrictions are lifted, and I know that's a state by state, county by county, with federal government kind of advising, 36% of the respondents here said that they would intentionally delay care after restrictions are lifted. So that guidance, that encouragement, saying it's okay, even with the policies that we're starting to read, there are still a large number of consumers that are hesitant about doing that.
Yeah, I read this like, this is one of those things where maybe we should have made the chart color instead of a nice aqua. Wait, go back, Chase.
Yeah, right there.
Okay, we're right. Are we right here? Sorry.
We're up one.
We're up one.
36%.
Okay, never mind. I was looking at what Chase said on the screen. I won't give away the ghost there. Yeah, this is still the likely to delay care. I'm going to respond to the next one. Sorry, I jumped the gun.
Okay. So we wanted to know, so if you're concerned about receiving care, you're concerned about going back to a hospital, what is it that you're most concerned about? And kind of back to the, heart attacks not showing up, is it the fear of being infected with COVID-19 is just surpassing your willingness to detect symptoms? But here we started asking the question, so when you think about seeking care after restrictions are lifted, how concerned are you about these different factors? And the number one factor and concern, tied with number two, is that risk of getting sick from other patients. So the isolation, the cleanliness of the facility, the separation, distinct areas for COVID versus non-COVID patients are critical to communicate, as are the cleaning procedures that are being implemented. And I know I've seen this from the airlines already, where they're talking about how they're cleaning airplanes and it's just safe, so I think this is a big concern of patients' willingness to go back to hospitals for care.
Yeah, there's so much to dive in on this chart. If you're going to look at any chart from a communication standpoint, it's this one, right? So first of all, this is what I was saying. Like we have a nice calming aqua color to designate a lot of concern. So when Ben's talking about that, 56% of the people have a lot of concern. If you threw in some concern about getting sick from other patients, we don't have the number on this chart, but it looks like to be about 95%, right? The second one, which is cleanliness of facilities, right? I mean, we have talked for years about the last thing you should be talking about in terms of building your brand as a hospital are things like safety, because you don't want to raise the idea that there's an alternative to a safe hospital, and cleanliness. Like, why in the world would you be talking about cleanliness as your hospital? Coming out of this, it's going to have to be one of the primary messages that you deliver. And even as you go down through this, there's so many things that are just so important to grapple with, right? The least concerned factor, right? So if you want to put it in the most positive light, the least concerned factor is lack of insurance coverage. All right. So when you hear that, it's like, oh, good. Like that's the least thing people worry about. 37% of the people surveyed have a lot of concern about that. Now, if you were to look at prior to this crisis, the level of uninsured in this country, it's somewhere in the low teens, right? Certainly you can talk about underinsured. What that's reflecting is that unemployment, 20 million people out of a job and sure to go up again this week. The loss of health insurance and the fear of what this is going to cost. Just saw an article today about how a couple of weeks ago, the federal government said that they would cover the cost of treatment for COVID for those who are not insured. But hospitals are still waiting. What does that look like? Patients are getting the bills. So they said they would do that, but obviously there's not anything concrete in place. So even as the least concerned factor, still a huge factor.
Right. We weren't going to cover these today, but there are a couple of questions in this third survey which do ask what consumers' expectations of insurers are. And they're basically expecting them to kind of cover the basics of, make sure that my tests are covered, pay you on time, maybe relieve some of the administrative burden during this time period. But that was about it for consumer expectations of payers.
Yeah, I think we have higher expectations of parents.
I think we do. Right?
We won't get into
the nature of our business. We have to have higher.
That's right.
So a number of these things give us ideas about how to communicate what we should communicate to consumers in order to encourage them to come back in the door once we hit all of these criterion that Chris mentioned earlier that are coming out from various entities about when we can lift and start to reintroduce some of these elective procedures. Let's go down to the next one. So actually one more thing before we go there. I wanted to let you know that as we run surveys across various markets and for different clients, we're always asking the question about what consumers and patients' primary concerns are. And the things that we usually see outside of the pandemic kind of situation are costs and physician availability and can I get in, right? Those fall very low on the rating scale at this point in time. So we really have seen a complete renorming of expectations of patients and their willingness to come in to see their physicians and go to hospitals. Okay.
Yeah.
And then I know we have continued to ask questions around who patients trust across the survey, starting with some of the media outlets, starting with different channels that were available, and then moving into different communicators themselves. And we asked this question again, specifically with the intent of understanding whose guidance patients would be most willing and interested in hearing from in order to feel comfortable about going back to a care facility. And the hospital physicians, the doctors, continue to stay in a #1 position as the most trusted entity. CDC is tied with physicians. So there's that local national collaboration that is expected by consumers in order to feel comfortable. And then number third, that hospital saying that it's okay, they come in third, a couple of points below the CDC and the physicians themselves. So I think it's interesting that, the physician continues to be the most trusted partner that a consumer has in their health care practices themselves. They have the relationship. They want to hear that from their physician, timing's right, it's the right thing for you to do, the facility's ready for you, we have all of the equipment, we're ready to be able to care for you again in a way that you have become accustomed to.
And I think what's interesting too there is the CDC coming in second. The CDC has always been seen as just a place for trusted information. I think that slipped a little bit in this crisis. They were slow to respond. There, of course, news reports about some of the testing issues stemming from the CDC. So you have to wonder, and also the CDC speaks to things at a national level, less so than a state or market or organization level. So it'll be interesting to see whether, if we continue the survey, that might move, where the information from the CDC is not relevant enough to my specific market or area for me to trust it. And I might look to hospitals or others locally to provide that, maybe state governments, I don't know.
Right. So that's where I think we see the trend of national information being provided, national guidance being provided, local interpretation, either government, county, state health officials, local health officials, having that interpretation responsibility and obligation going forward.
Yeah.
So I think that's the last thing that we wanted to call out specifically on the survey this time. As we mentioned before, a number of the previous questions are still there. There wasn't a significant change other than in one specific thing, and that was, how long do you think it's going to take till we get back to the new normal? And we saw, again, a significant drift where people started thinking it's going to take longer than I had anticipated previously. So in that 4 to 8, 1 to 2 month kind of time frame, 4% drop. We saw a 10% drop in the 3 to 6 months, and we saw it being picked up on the back end with 6 to 9 months and even greater than a year. So I think everyone's adjusting to what is new normal, how long does it take to get back there, outside specifically the healthcare needs, just how long is it going to take for things to get back to a point where, Chris, you and I don't have to say hi via Zoom and fist bump maybe when we see each other, but actually communicate in ways that we used to. So
yeah, if I can do like the last thing you're supposed to do with a quantitative survey, which is try to extrapolate a little meaning out of the word normal, because I think a lot of us would say, well, we're never going to get back to normal, or things will change in many ways, not just healthcare, but societal, where normal will look completely different, right? I think when people look at this, particularly in the context of the survey, they are thinking about what you're talking about, Ben. They're thinking about, when will the stay-at-home restrictions be lifted? When will social distancing stop? When will restaurants open? When will the things that have gone away, that have really taken us away significantly from normal, come back, right? Like, we may always, like, handshakes may go away forever, right? Even though that might have been normal, it may not be normal coming back. But I think that is, to your point, what people are really considering when they hear that question. So there's one more thing I wanted to ask about. It still just startles me, Chase. I don't know if you can find it really quick. The change in understanding or awareness of telehealth, which I know that when the first time we had the results of the survey, I was startled by the level of people that that had not heard of telehealth or virtual care. So there it is. The first time we ran this was a month ago. That seems so long ago, right? 42% of people had not like, this wasn't, have you used it? Do you understand it? Would you consider it? It was just, have you heard of it? And 42% had not heard of it, which is, again, still stunning to me. I guess, it just shows when you're on the inside of an industry, how much, you're into it versus the people on the outside. But I am glad to see that in a month that has maybe moved to a level that I would have expected, where now we've got the vast majority of people saying, yes, they have heard of it. Is there anything surprising to you about that, Ben, either in the where we started or the swiftness with which it's changed?
We've asked a couple of different questions surrounding this, and we commented on the 13.5% jump last time I was on. I would say I'm surprised that people haven't heard more of it. And when we started asking questions about whether health systems had communicated it, that's where we saw kind of a lower percentage than I would have thought. So it didn't appear that it had been ingrained as part of the normal operations and communicated that way by health systems previously. I would say that under the conditions that we're in, it's become a lot easier for the systems to talk about it as an alternative to maybe to services that they can't currently get, right?
Yeah, and obviously things like CMS reimbursement restrictions have been eased or lifted, which those have prevented a lot of the progress of this. And we talked about this last week. Hopefully, those are the kind of things that don't return to normal. If normal was we're gonna take 3 years to figure out whether we can reimburse virtual visits, which is where it was at a certain point in the not too distant past. Let's just keep it where it's at. Like, why in the world would we not encourage this? It's less expensive for everybody. It's more convenient for everybody. And even we're hearing from physicians who are, on one stage were reluctant, who are now saying, hey, this is great because now I'm getting to see the patient in their environment. I'm getting to see them in their home. I get to meet their dog. I get to see their kids. That's a factor of everybody stay at home. But even if that wasn't the case, you still see people in their environment as opposed to every patient who across the spectrum coming in and they all are in the same, physician office. So you lose a lot of that. So it's all a good thing. Let's just hope we can keep it all in place moving out of this. All right. That sounds like a good place to wrap up. Please let us know if there's something you'd like us to cover. We're trying to be as responsive as possible to people who listen. You can post something in the chat channel right now to Chase. You can email me at cab@thinkrevivehealth.com. Ben, thank you so much again for joining us, as always.
Chris, thanks for having me. Chase,
you bet. Yes, and Chase, sir, thank you.
Absolutely.
Reminder again, tomorrow is our very special 1-hour episode with Brandon Edwards, where we're going to dive deep into rapid recovery, something all health systems, no matter where you're at, should be thinking about right about now, at least planning for it. Remember to visit our website, thinkrevivehealth.com. Go to /COVID-19 for that communications hub, a recording of today's episode, and/or subscribe on iTunes. And we will sign off as we do every time. Keep up the great work. Hang in there. If you're in a marketing communications function at a hospital or health system, we're getting through this in large part thanks to you and the work you're doing. You're doing amazing things to help your organization and help us all get through this crisis with health information. So we all appreciate what you're doing. We're here for you. As long as this crisis is with us, we'll be back every day, and we will be back tomorrow. So thank you for joining us.